it can't get better, but can it go to the other side of the spectrum and get worse?
So, yes and no, in the sense of um, Chiari malformation, again, because it's an anatomical problem, it's something that can change with growth. In the sense of, as the head grows, the shape of the skull can change and the amount of space that's there can change. I have seen it get better. I have seen it get worse. I think more likely it'll probably stay about the same in terms of the anatomy because she's 11. So most of the head growth has taken place already. Can it change with growth? Yes. But our head actually, most of our head growth actually happens in the first year of life. So her head isn't going to grow that much more, even though her body may continue to grow. So the likelihood of it changing anatomically is going to be low. Symptomatically is something where it can change. Again, I think it's probably more likely to get worse than it is to get better, just because of it's the type of thing that it can just get irritated. And when it gets irritated, that area of the brain can get a little bit inflamed. Not necessarily, you get inflammation, not necessarily something you're going to see on an MRI, but just enough that things are more likely to get triggered. And once it starts getting triggered, then you kind of keep triggering it because of that irritation. Now, I think to get to a little bit of what you're asking, though, we don't intervene based on the fact that it's there. Like in the sense of there's a lot of people walking around with Chiari malformation that is not symptomatic, and we don't treat it because of that. We treat it for the symptoms, and if the symptoms are impacting on life. Now that can happen a couple of different ways. One is you're getting the symptoms so frequently that it's preventing you from doing something. Or, and I'd ask you the question in another way is, are you not doing things because you're afraid you're going to get symptoms if you do it? And although, and so that, affects, how we're living our lives and what we're doing. Now, I don't know, have you gone down the rabbit hole of Google and Chiari malformation?
Oh yeah.
Yes. Okay. So, I mean, obviously, there's a lot of different information out there that you can find on Google. Some good, some bad. I mean, I think at the end of the day, a lot of what we see and what we find with Chiari really is based on, the symptoms. So I think a lot of the Chiari rabbit hole is that any symptom any human has ever had at one point or another has been attributed to Chiari malformation. And I think in a lot of cases, a lot of those things happen and are in a patient that has it, but they're not related. And I think one of the important things, or most important things for figuring these things out, is kind of that test in some ways. The patients that I think are most likely to improve with intervention are going to be the ones that the symptoms are going to be most likely from Chiari, and symptoms that we can generate by having you do that are probably the highest likelihood of being related to Chiari. So what that does is that puts you into the category of symptomatic Chiari malformation, which also gets into the question that a lot of people will ask is, how does this affect my activity in the sense of restrictions, or what can I do, what can I do? I don't know if you kind of were looking at that stuff. I do not restrict patients with asymptomatic Chiari, like based on the literature that's out there. Because what that suggests to me, if you don't have symptoms, body is compensating. Once you get symptoms, and that tells us that you don't have as much of a reserve or as much of a threshold before symptoms are caused, and therefore the risk of getting worse is going to be higher because your body's reserve is a little bit less because you're already able to trigger symptoms. Does that make sense? So it's kind of getting a little bit at what you're not exactly answering the question you asked before, Dad, but kind of getting at kind of the risk-benefit profile of treating and not treating, in the sense of people who are completely asymptomatic, there's not really a benefit to treatment. And we think that the risk of something happening, some kind of injury or something else, is going to be low because there's not symptoms. And the body has kind of is telling us that it's able to compensate for things going on. Whereas when it doesn't take much to trigger things, it kind of suggests you don't have as much. The analogy I use is kind of, we're all kind of with symptoms standing a certain distance away from a cliff, right? And I think if we're asymptomatic, it suggests we're further back from the cliff. Our body has a little bit more room to fall before you kind of get pushed over the edge, is kind of the way I tend to think about symptomatic versus asymptomatic in that regard. Questions about any of that?
I mean, it sounds like what you're saying is that this is maybe a wait and see, and not to think about surgery at this time.
No. I'm saying I would think about it, but it's up to you. I guess I'm not clear. I'm saying is that it's more of a, depending on how she's doing, that determines whether we talk about doing something now or doing a wait and see.
Okay,
So
and that's what I meant by wait and see, right?
Yeah.
Okay.
Yeah. No. So if you guys were to say, you know what, these headaches are really keeping her from doing what she wants to do, it's a significant impact on her quality of life, then I would say you should treat it and not wait and see. Mm-hmm. Whereas if it's like, you know what, it doesn't bother me that much, I'm not missing out on things I want to do, I can do that, then I think wait and see is appropriate. I think based on what you're saying, I think either is appropriate, and I'm not advocating for either. I'm advocating for, and that's what I was saying earlier about you guys talking about what the impact of these symptoms is on her daily life, or weekly life, or things like that. Because if it is a significant impact, then what I can say is there is a benefit to treating, because that you get better. And that's something that we know happens like that. I have, Chiari is the one diagnosis I also treat in adults. I do primarily kids, but I treat Chiari in adults as well. And so I would give an example of, actually, as a physician's assistant who, like a family practice physician's assistant that I saw for Chiari, and clearly she was symptomatic, but she was like, you know what, I can avoid these things and just kind of live with it, because she'd been living with symptoms she was like in her mid-30s for years. And so I saw her back in 6 months, and the next time she brought her sister, and we talked about it, and, maybe she was starting to come to maybe this limits me, but wasn't ready. So the next visit, 6 months later, she brought her husband, and then finally decided to do it. And, she's over a year out now, she's been discharged, and she's like, I don't know why I didn't do this sooner. I can run now, I can do all these things I wasn't doing before. Obviously surgery wasn't fun, but she's like, I feel so much better now, like I wish I had done it sooner. Now, not everybody is that way. But the reason why I give that story is it's not, the decision is really, is there an impact? Because if there is, there's not really a benefit to, getting back to your earlier question, to the wait and see approach. On the other hand, if it doesn't really bother you that much, and